Hello, everybody. Welcome back to another lecture in the Medical Microbiology for Medical Students series. Today is the last lecture where we're talking about typical bacteria, and we'll be finishing off by talking about anaerobes. So again, my name is Brody Duncan. I am a physician and medical microbiologist at HRLMP, and I am an assistant professor in the Department of Pathology and Molecular Medicine at McMaster. So today is going to be a bit of a shorter day. We're just going to go over the names of the medically important anaerobic bacteria so you know which ones to focus on as you go further in your training and clinical experiences. And we will talk a bit about the epidemiology of these medically important anaerobes. So here is our big slide that we'll be looking at for the last time, where it's all the bacteria that are typical ones that will grow in blood cultures, urine cultures, those sorts of things that I think you need to know at the medical student pre-clerkship level. And today we are talking about anaerobes. This is a small little group at the bottom. So first we have to talk about what actually are anaerobes. I think it's easy when you're learning about it for the first time to put it in this dichotomy of we have strict aerobes and strict anaerobes, where if we look at these test tubes and we imagine that the medium close to the top of the test tube, where it's right at the interface with the air, is going to have quite a lot of oxygen in it. So we can have lots of aerobes like Pseudomonas growing up there. And then at the bottom of the tube, all the oxygen has been used up and is not getting replenished. So that's where we would find anaerobes like fusobacteria. So I hope that makes sense, that we have aerobes that like when there's lots of oxygen available, and then anaerobes that actually suffer when there's oxygen and they want to be as far away from the oxygen as possible. However, this dichotomy is a little bit oversimplified. So most medical pathogens, to be honest, are what can be called facultative anaerobes. In the sense that they are able to do all of their metabolism anaerobically, but they don't hate oxygen, and they can actually do quite well in oxygen. So a lot of our common bacteria like E. coli, Staph aureus, Enterococcus fit in this facultative category, where they can facilitate metabolism kind of no matter where they are. And that's part of the reason you see them in so many different types of infections, is they can really do well in different environments. This contrasts with microaerophilic bacteria. There's not very many. Campylobacter is an example, where they need oxygen, but not too much oxygen, but also not too little oxygen. They just need this like micro amount of oxygen, and so that's why we call them microaerophilic. They tend not to cause all sorts of different types of infections because they can't survive in many different places, and they're not very common, to be honest. And then the last group is aerotolerant anaerobes. So these are organisms that are often part of our normal body flora, like Cutibacterium and Lactobacillus, that are anaerobes. Their metabolism does not require oxygen, but as opposed to our strict anaerobes, they actually can tolerate a decent amount of air exposure. So that's part of the reason they're part of our normal flora, is that if they live in our mouth, in our esophagus, in the genital tract, they might be getting exposed to the outside atmosphere regularly, and they're just saying, you know what, I'm okay with that. I'll tolerate this, even though their primary goal is to be anaerobic. So these are the main groups of oxygen utilization in medically important bacteria. And I think it's useful for you guys to be aware of them, just because I think when we talk about it casually, about aerobes and anaerobes, it's easy to think, oh, there's a strict difference between them. But there's actually this huge spectrum of oxygen utilization. And sometimes you've got anaerobes growing in aerobic cultures and vice versa. A particular relevance to this is trying to understand the epidemiology of anaerobes. A lot of anaerobes of medical importance are part of the normal flora of the human intestinal and gastrointestinal system. And you can imagine that if we start at the mouth, there's a lot of oxygen in there. So we're not really having strict anaerobes there. But then as we progress further and further into the intestine, the amount of oxygen is getting lower and lower. So a lot of our strict anaerobes are living in these kind of deeper parts of our intestinal tract. So when you think about infections, if you have an infection that's just superficial in the mouth, you might not expect there to be very many strict anaerobes. But if you have an infection, for example, deep in the intestines, like you have a perforated appendix, then you would expect there to be a lot more strict anaerobes. So this is just important as we go through to try and understand kind of the epidemiology here. This does apply to any other body site that has mucosa. For example, the genital tract is open to the outside environment, but as you get further inside and also as you get closer down to the actual mucosal cell layer, the amount of oxygen drops and you can get more strict anaerobes. The same thing happens in the mouth, where even though the actual oral cavity is obviously full of air, as you get closer to the bottom, for example, deep down where the teeth meet the gums, you can have the oxygen getting used up by the bacteria that are higher up, and then these lower down bacteria can be a lot more anaerobic. I know this is all very complicated, but I think it's just a useful little summary for you to understand the diversity of anaerobes that there are. So now we're just going to briefly go through some of the most medically important anaerobes. We're not going to spend a lot of time on these because honestly, you don't see them all that much. And clinically, when you're treating with antibiotics, it's easy to lump them together into big categories. So Bacteroides, with the specific species being Bacteroides fragilis, is probably the most medically significant anaerobe that you'll see nowadays. It is an organism that can be part of the normal flora, mainly below the diaphragm, because it's a relatively strict anaerobe and does not want to be exposed to a lot of oxygen. There's a million other species of Bacteroides, but B. fragilis is definitely the number one. And he is not our friend, even though he's part of our normal flora. If you let it just sit inside your intestines, it's not a big deal. But as soon as you start to open things up, for example, with surgeries, there's an opportunity for these bacteria to go where they're not supposed to, which is outside of the intestinal lumen. And from there, they can cause quite a lot of aggressive infections. So for example, if you have a colon cancer, and then that perforates the intestinal lining, you can have spillage of stool along with these anaerobic bacteria into your intestinal tract, and then you can have quite severe infections because of that. In fact, this is so common that when doctors talk about anaerobic coverage, for example, adding antibiotics like metronidazole, they are often specifically talking about covering Bacteroides fragilis and the bacteria like it, because they are resistant to a lot of our more common antibiotics that we use, like ceftriaxone. Fusobacterium is another relatively common anaerobic bacteria. Two common species are Fusobacterium nucleatum and Fusobacterium necrophorum. I don't expect you guys to be able to differentiate those, but this is just so you've at least heard those names once. They can live above the intestinal tract, for example, in the mouth, but they're also in the GI system. And they are also not our friends. So, they're classically associated with more head and neck type of infections. For example, if you have an oral cancer, especially if it's destroying the normal tissue planes, then these bacteria that might be found deep in the oral cavity, for example, close to the teeth, can then invade into the soft tissues and cause quite nasty infections. The mouth is obviously very close to the brain, and because these are quite pathogenic, sometimes they can also spread from the mouth through the sterile tissues and cause, for example, brain infections. So these are quite nasty infections. Moving on to some gram-positive bacilli. Clostridium is the number one gram-positive anaerobe that you need to know. They tend to have spore-forming bacilli, and you can see that in the picture of a gram stain here. Clostridium perfringens is one of the most common and most aggressive. Again, not your friend. This one can cause very severe soft tissue infections if it gets where it's not supposed to. You can also see them in GI infections along with Bacteroides, so it's really quite a virulent organism. It also causes food poisoning, which is a little bit bizarre. You can think of this similar to organisms like Bacillus cereus, which is an aerobic gram-positive bacillus that also forms spores. So here's a case of a more aerotolerant sort of bacteria where, the spores can survive out in the outside world. And if it gets in your potato salad and you let it sit out, then you might get quite sick with food poisoning if the Clostridium perfringens starts to grow and make toxins. There's a few other Clostridia to be aware of. Clostridium tetani is obviously the organism that causes tetanus, and this is particularly aggressive and life-threatening. It's actually more of an environmental organism. That's why we always think about it in, association with rusty nails, stuff like that. But if you get a wound, and it doesn't have to be a humongous wound where you actually stepped on a rusty nail, it can even be more minor wounds. But if they get dirty and C. tetani gets inside it, then that's how you can get tetanus, which is truly a horrible disease. So anytime you have a patient that has a dirty wound, please make sure that they are up to date on their tetanus vaccines, because that could potentially save their life. C. botulinum is kind of like a cousin of C. tetani. They both cause disease through various toxins, but botulism is a little bit different than tetanus in that it is still very nasty. It is still in the environment. So it can still cause infection through contamination of wounds. It's historically been associated with honey, but the sort of disease it causes is where you actually lose control of your muscles, and then you have to go to the ICU and get intubated because you can't even, for example, move your diaphragm. This is historically associated with babies eating honey, but you can see it in all sorts of people. So again, not a very nice Clostridium. Finally, C. difficile is now called Clostridioides difficile. They've decided it's separate enough from Clostridium to give it its own little genus. And to be honest, it actually is fairly different, both in terms of its clinical presentation, because it's nasty, but it mainly causes GI disease. It doesn't really cause these toxin mediated musculo-nervous damage. And it also doesn't really cause tissue invasive disease. And it also doesn't really grow in our cultures. So I'm not going to say any more about C. diff. I think you'll have to learn about that separately. Actinomyces is a gram-positive bacillus that is not spore-forming. It has these more filamentous type shapes. I'm not going to say very much about it because it's not very common, but it's often part of the normal flora. It can be above the diaphragm. It can be below the diaphragm. It sometimes causes invasive disease. For example, it can cause this cervicofacial actinomycosis, where it has this chronic draining wound from your face, kind of coming from the mouth where the infection might have started. But this is not very common, and I would call this a lower priority anaerobe to know. I will say there are a million other anaerobes, and all of them are kind of like actinomyces, where they're part of the normal flora. Sometimes if they get where they're not supposed to, then they'll cause disease. I'm not going to waste your and my time by saying all these very long names out loud. This is more just so that you're aware that they exist, and if you ever have a patient that has these infections, then you can say, oh, maybe at one point I saw them in a slide years ago in medical school. But honestly, for these sorts of organisms, even for me, I just look them up to remind myself exactly what's going on here when I see them in a culture for a patient. So that's all I wanted to say about anaerobes. Again, Clostridium, actinomyces to a lesser extent, but especially Bacteroides and Fusobacterium can be very virulent and can cause serious disease. But if you see them in your cultures, think about the patient's clinical presentation and if it's in keeping, and treat them if it's appropriate. And with that, we really talked about all of the quote unquote typical bacteria that I think that you guys need to know. Here are the picture references, and thank you for joining us.